Hello guys, today we will discuss about the arterial supply of the nose. The nose is mainly supplied by internal carotid artery and the external carotid artery. These two arteries mainly give branches which supply the nose. First we will see the external carotid artery. The external carotid artery gives two branches, that is maxillary branch and facial branch. The maxillary branch again give branches of lesser palatine artery, greater palatine artery and sphenopalatine artery, and the facial branch give to superior labial artery. From this only the sphenopalatine artery, greater palatine artery and the superior labial artery give supply to the nose. Now the internal carotid artery, it gives the ophthalmic branch which is divided into anterior ethmoidal artery and posterior ethmoidal artery. From here the anterior ethmoidal artery gives branches to the nose. So this anterior ethmoidal artery, sphenopalatine artery, greater palatine artery and superior labial artery together forms the Kieselbeck passage, which is commonly known as Little's area. It is the more common site of epistaxis. Now we see briefly about the course of the external carotid artery. The external carotid artery gives the maxillary artery and facial artery. First we see the maxillary artery. The maxillary artery goes to the infratemporal fossa, then it goes to the sphenopalatine fossa and give two branches, which is greater palatine artery and sphenopalatine artery. The greater palatine artery passes through the greater palatine foramen and supply the palate and goes upward to supply the nose. Then sphenopalatine artery goes to the sphenopalatine foramen and supply the nose. It mainly supply the lateral wall and the septum. Again facial artery, which give the septal branch of superior labial artery, supply mainly the septum. Now let's see the internal carotid artery. Internal carotid artery gives the ophthalmic branch which enters the orbit through the optic canal. Again it passes through the lamina propria and give the anterior ethmoidal artery and posterior ethmoidal artery. The anterior ethmoidal artery then passes through the anterior ethmoidal foramen and form anterior ethmoidal notch, which is also known as nipple sign. Nipple sign is significant because it should be identified before FACE, that is functional endoscopic sinus surgery. After that it gives supply to the septum and lateral wall of the nose. Again posterior ethmoidal artery passes through the posterior ethmoidal foramen and give supply to the septum and lateral wall, mainly the posterior superior part.